Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Baldwin University with a joint faculty position at Ross University School of Medicine. And in this video, I want to use this opportunity to raise awareness for sickle cell awareness. Now, this month is Sickle Cell Awareness Month. So I think it's important to shed light on this, what I would still say a disease that's not known well in the general population. In fact, this was a disease that I had discussions about, and at the end, feel like there was not enough understanding to incorporate this. So this is a disease that mainly affects African Americans within the general population, and the trait was associated with protection against malaria, believe it or not, and dengue, and some of the diseases coming from mosquitoes. Anyway, let's get started here. So what is sickle cell disease? Sickle cell anemia, which is eventually is causing decrease in the hemoglobin, but specifically what is going on is an abnormal sickling in your cells. And this is not a disease. So first of all, you look at the actual red blood cell. One red blood cell survives for 90 days, by the way. You look at the red blood cell, and due to the mutation on the beta portion of the hemoglobin structure, there's actually sickling within. So the concavity of the blood cell is kind of distorted due to the improper folding. And I'll explain to you why. There's actually a mutation in position 6 at the beta chromosome. And in position 6, there's a missense mutation, which then results in replacement of one amino acid for another. In this case, if you're aware of the 20 amino acids that are go from transcription to translation, then you know about glutamate or glutamic acid, and this acid is also known as glutamate. Is then converted in to valine, and so just that one alteration. Imagine this, one alteration in one amino acid in one protein series is causing a whole plethora of conditions, and I'm going to go over all of them within the context of this presentation. But I also wanted to pay tribute to one of my mentors who has passed away a couple of years ago, Dr. Walker, who has who had shown me many of the ways to treat sickle cell, and also understanding the constellation of symptoms that are associated with sickle cell disease. So I want to share with you not only the complications and the symptoms associated with sickle cell, but some of these experiences and how it was important. My mentor instilled in me, Dr. Walker, that it was important to focus on preventing the painful crises that the patients were going through. And many times this was a difficult balance, because the painful crises would then only be able to be addressed through opioid-related medications. So if you see the delicate balance in pain control versus being able to judiciously prescribe certain medications is delicate, and is a bit of an art because there's not enough intervention studies to assess for these questions. So I wanted to provide you with that additional clinical insight. But just thinking about the prevalence, a quarter of people worldwide suffer from anemia. And so I'm not saying that a quarter of the world has sickle cell anemia, but what I am saying is that anemia as a condition should be properly assessed for anyway, whether it's sickle cell or not. And so it's important that sickle cell disease, of course, has more emphasis, especially among African American populations, due to the almost exclusive preponderance in this population. And so some only have sickle cell trait. Again, protective against malaria, focus on prevention is needed, so that the underlying organ damage not only can be assessed, but also prevented, delayed or prevented. So how is underlying organ damage taking place? Well, one way that it's taking place is after experiencing repeated vaso-occlusion. So if you have repeated vaso-occlusion, say any organ, let's say your liver, if you have vaso-occlusive areas, then specific areas may stop working. If you have vaso-occlusive episodes within your mesentery, within your bowels, then you can have necrotic bowel. So vaso-occlusion is not something to be taken lightly. And these repeated episodes then can lead to not only temporary occlusion, but potential permanent occlusion. And when it's in the context of coronary artery diseases, this can lead to additional cardiovascular disease. Additionally, there's chronic hemolytic anemia, which may take place within the spleen when it's filtering out a lot of the excess. Organ dysfunction leads to, of course, when you're thinking about all these conditions leading to organ dysfunction, well, that leads to high healthcare resource utilization, poor quality of life, and shortened survival. Bottom line is organ complications from sickle cell disease can lead to mortality by age 30. Just put that into context. Much more efforts need to be done to try to prevent these conditions, track sickle cell disease, track sickle cell anemia before it gets to the point where you're having vaso-occlusive crises much more frequently, and then causes infarction. So now we're going to differentiate between acute versus chronic, and I'm going to try to wrap it up in the next 1.5 minutes. Acute pain from vaso-occlusion, painful crises, typically felt in the extremities, chest, and back, are the primary reason for emergency department visits, and in some cases, vaso-occlusive crises can lead to sudden unexpected death. So one of the things that my mentor actually taught me is that many times individuals that are going through these crises, a quick call to the physician, either telling them about the crisis or afterwards, so that the physician is in the loop within the care plan. The next complication is acute chest syndrome, which is similar to an MI. Can or will affect approximately 30% of people living with sickle cell disease. So acute coronary syndrome severity increases with age, and more than 10% of adult cases are either fatal or complicated, which is a pretty high percentage, by neurological events and organ failure. Infection rates are high in children with sickle cell disease and are associated with an increased risk of death from sepsis infection, such as parvovirus V19, which can result in red blood cell count drop. And this leads to aplasia and actually may require blood transfusion. And then priapism is actually a very painful involuntary erection. It's a non-sexual penile erection that is associated with sickle cell disease. And it can be experienced by as high as 67% of males living with sickle cell disease. And I would imagine this is a very uncomfortable feeling. And so, although this condition is underreported, recurrence may lead to impotence. So this may be an embarrassing condition to communicate with your physician, but if you are an individual that is going through this, it would not be something that would be unwise to talk about. So you have other acute complications such as stroke, very serious, cerebrovasculopathy and splenic sequestration, which is something that is experienced earlier in age, where this can actually lead to death, where the spleen starts to kind of take all the blood cells and kind of hold them and not let go. And so that can lead to death. So what are the long-term potential consequences? Believe it or not, sickle cell retinopathy, you've heard of diabetic retinopathy, but sickle cell can do the same thing. Pulmonary hypertension, of course, within vascular supply I've already mentioned, but the pulmonary artery can be affected negatively as well. That is coming out of the right ventricle. And so that can lead to pulmonary hypertension, cardiovascular complications, of course, within the coronary arteries, can lead to myocardial infarction and other types of diseases. And then there's cerebral vasculopathy, just thinking about the preponderance of stroke. If you have a vaso-occlusive event in any of the arteries that are contained within the circle of Willis, or any other parts of the vascular supply within the brain. So this is also other complications that you can go through: cholelithiasis, gallstones, renal dysfunction, avascular necrosis of femoral head, one of the biggest joints within the body, which has a lot of vascular supply, and any sort of embolus that comes out of that can lead to even death, and then recurrent chronic leg ulcers. So when you're thinking about sickle cell complications, silent stroke, asymmetric cerebral infarction, depression and anxiety, and organ disease. So what are the recommendations? What do we need to do still with sickle cell disease? After all, it is sickle cell awareness. So comprehensive care may require more than just treating overt complications. That is crucial. And when we were in the hematology clinic, we always encourage patients to get to maintaining the medication and making sure these crises don't take place, because they're not only disruptive to the individual that is experiencing this, but also there's a lot of healthcare utilization that occurs through the process. And the patient care for sickle cell disease may include monitoring progressive damage, managing acute and chronic complications, and planning for long-term care. So we went over progressive damage, we went over acute and chronic complications, and then how to plan for long-term care is, of course, always very important, because then you know how to manage this disease and make sure that is in a sustainable way. I hope this has provided you with insight, and again, you've gained awareness, more importantly, about this condition. Thank you for listening.